Hi, everyone. My name is Mary Giliberti, and I am the Executive Vice President of Public Policy here at MHA. I am so excited to introduce and chat with our next speaker, an amazing disability advocate and my friend, Rebecca Cokley. Rebecca is the director of the Disability Justice Initiative at the Center for American Progress, where her work focuses on public policy issues for disability community. Most recently, she served as the executive director of the National Council on Disability, an independent agency charged with advising Congress and the White House on issues of national disability public policy. She joined NCD in 2013 after 4 years with the Obama administration, where she worked at the Department of Education and the Department of Health and Human Services, which is where we met, and also did a stint at the White House working on diversity and inclusion issues. In 2015, she was inducted into the inaugural class of the Susan M. Daniels Disability Mentoring Hall of Fame and was the recipient of the Frank Harkin Memorial Award by the National Council on Independent Living, one of the most important awards for the disability community. Welcome, Rebecca.
Thank you so much, Mary. It's wonderful to be here with you today.
Well, great. Let's start off talking about the Disability Justice Initiative, since you are the founder of this initiative, and I know you, and I know you are very deliberate with how you talk about things. So what does justice mean to you in the context of disability inequity, and how does your own experience inform that?
So the framework of disability justice came out of the Bay Area in the early 2000s, largely promoted by an organization called Sins Invalid and Patty Byrne. It really focused on the notion that our end goal is not the acquisition of rights, because we can have all the rights in the world, but that doesn't mean that we're treated as equal when we're out in society. And so what would justice look like? And so the disability justice framework is really grounded in roughly 10 different components. Language which is pretty well known by a lot of folks, things like cross-movement organizing and cross-movement solidarity, being led by folks that are the most impacted by the various issues that people are living with. Actual intersectionality, so not just diversity, as a lot of organizations misuse intersectionality, but actually grounding conversations in what does it look like when racism and ableism are compounded, let's say in the context of COVID, or in the context of criminal justice reform. And our center was built, we just celebrated our second anniversary. We are the first center of our kind that focuses on disability policy at any of the DC-based like quasi-political organizations or think action tanks, as our CEO likes to call us. And our focus has really been, how do we bring the disability community to the table on progressive issues? And how do we bring the progressive community to the table and rallying support around disability issues? You know, for me, I grew up in the disability movement. Unlike 80% of folks in our community, I'm part of the 20% whose parents had the same disability that I have. And you know, since we're doing this remotely, hi, I'm a little person. You know, that's typically what people perceive of as my primary disability. You know, I also come to this space as a person that lives with anxiety, as a person that has a very obnoxious, once every 3 years or so, reoccurring heart condition that's really annoying. But because I have an apparent disability, a lot of times people presume that that's the one that impacts my life the most significantly.
So you mentioned in your remarks COVID-19 and how that has exacerbated different disparities that we've seen in the health and the mental health systems. Can you talk about how COVID-19 is affecting the disability community and what we could do to better meet people's needs?
You know, honestly, for us, we started mourning our dead back in February. It's the reality of the times that we live in. It's the reality of having the understanding that people with disabilities across the board, whether it be people with mental illness, people with chronic health conditions, people with mobility impairments or sensory impairments, et cetera, are all disproportionately impacted by any major crisis. And COVID is definitely a major crisis. We know that roughly between 1/3 and 2/3 of the fatalities tied to the coronavirus are tied to nursing homes and other congregate settings. And most times people only think that nursing homes are where aging folks live. They don't realize that there are a large number of people with disabilities that live in those residences. Additionally, those caregivers who may also provide care in other sorts of settings have also contracted COVID and died from it. And so when we're talking about the issue of the coronavirus, it has both killed people with disabilities and also at the same time created a whole new wave of people with disabilities. They're called the LongHaulers, which is the term being used to describe people who contract the coronavirus and it lasts for more than the 3 or 4 weeks that it typically lasts for. But these are people that have had symptoms of the virus for 5 or 6 months now, with no relief in sight, largely.
Right. So we'll have to be thinking about how to meet their needs, this new community that joins the disability community. And what other public policy issues do you see as relevant? Hey there.
We have a special guest star that has escaped from his playroom.
Hi there.
And so, when we're talking about the other issues that impact us, I mean, it's the issues impacting all Americans. We're talking about jobs right now. Our folks are the majority of low-wage workers. And so when the recession hit, it was our folks that were, most recently hired, most recently fired. We're still fighting back against the pervasive use of subminimum wage for people with disabilities. Conversations around educational equity are particularly impacting our students right now, regardless of what their disability is. Students that have 504 plans or individualized education plans may not be receiving their accommodations right now. And even as schools try to think about how to provide those services in the context of remote learning, it's hard enough for kids without disabilities, but thinking about what does that look like for families where children have disabilities or families where teachers might be disabled.
Right, for sure. Lots of important issues there to be thinking about, and thinking about, as you said, students with disabilities, sometimes multiple disabilities, right? So this year, we celebrated the 30th anniversary of the ADA. And that was really exciting, I know, for you and me, just a major milestone. And a key factor that we know in passing that bill was sort of the unity of the disability community, mental health being as protected, fully protected as other conditions. And I've been asked, and I'm sure you've been asked also, what is the relationship between the disability community and mental health conditions? And I think a lot of people asking that question think of disability as physical disability and don't see the whole array of disabilities that come under that umbrella term. Can you talk a little bit about the relationship or how you think mental health conditions fit within the disability justice movement?
Definitely. I'm really glad you brought that up. It was actually funny, just a moment ago, I passed by one of my other rooms and I had a bumper sticker on the wall with a quote from Paul Wellstone. And, Paul Wellstone really was in a lot of ways the congressional champion on mental health and mental illness for so long. And he was very key in that he specifically saw it as part of the disability rights movement. And I think when we think about the crafting of the ADA, one of the things that I think was so brilliant, particularly on the definitions piece, is the fact that it's not a checklist. It talks about any mental or physical impairment that impacts your activities of daily living. I remember sitting down with a colleague of mine who's a well-known activist in the African American community, and one of the things that she said was, I have depression, but I don't consider it a disability, because she was very much stuck in that mindset that a lot of people are, based on like looking at accessible parking and seeing the symbol for disability being like a white dude in a wheelchair. And I said, okay, well, let's unpack this a bit. And I said, does it impact what you eat? And she looked at me and she said, I've been noshing off the same 2-pound bag of gummy bears like all weekend. And I was like, okay, check. And I was like, does it impact what you wear? And mind you, this was pre-COVID when we're all like wearing jeans or shorts under like our nice shirts and blouses and whatever. And she was like, I've been wearing nothing but tracksuits for like a month. And I was like, okay, does it impact how you get along with your loved ones? And she said, yeah. She's like, I haven't taken my mom's calls in a week because she keeps telling me to go to church and that's not the answer. And I paused and I said, well, welcome to the disability community because you actually fit the definition of the ADA. Those are key activities of daily living. And the fact that it impacts those pieces like means that you get all the rights that come with the ADA. You get the protections around employment. You get the right to ask for reasonable accommodations in your job. And I said to her, I was like, do you ask for time? Do you ask for a schedule that allows you to see your therapist when you need to? And she was like, I can do that? And I was like, yeah, the ADA says that you can. And so I think for so many folks, so much of the imaging and the media around disability in this country really still largely frames it on like physical disabilities, like apparent disabilities, things that you personally witness about somebody. And we know that that's also not the largest population of people with disabilities in this country. The largest population are people who have disabilities that we can't see.
Mm-hmm. Mm-hmm. Yeah. So, and this goes to the point that when thought leaders, foundations, policymakers, when they talk about health equity, I feel like many times the needs of people with disabilities, including mental health conditions, aren't even included as an equity issue. So I feel like this is another area that sometimes is not included where it really needs to be. Why do you think it's important to consider disability along with these other issues of equity as we talk about and think about how we generate health care that provides good outcomes for everybody?
We know that disability is represented in roughly 1/3 of households. So if it's not in your house, it's in your neighbor on the left or your neighbor on the right. And so any conversation around how we create more equitable communities, and specifically equitable communities in the context of health, has to take disability into consideration. I do think one of the challenges in a lot of rubrics used that are grounded in a health equity approach is that they really approach disability as a problem that needs to be solved versus disability as part of the diversity, part of the landscape of any community. And to me, that's what makes that sort of framework fail a lot of times, or not receive or not achieve the outcomes they want to achieve, because they're not thinking about the fact that their neighbor needs home and community-based services, that their friend's child might be autistic and need speech therapy or other supports and services to be able to live and thrive in their school. They might not think about the fact that, hey, they live in a community that's pretty far from a post office. It would be really great for the aging folks in the community and for the disabled folks in the community if they had a box on the corner. And what does that mean for the overall equity and the achievement of health equity for that community?
Mm-hmm. Yeah. And I mean, already you're talking about looking holistically across movements, which I know is just a hallmark of the work that you do. This is something that you are very passionate about, and it is so important. And so as you were just talking about the post office, it really got me thinking about the issue of elections, right? So we know that accessibility of voting has been a longstanding issue. You and I have been working on that for many years. Can you talk about elections and accessibility from an equity lens that is cross-movement, right? That includes disability, race, income, a lot of the things that we think are going to affect our elections.
Definitely. I mean, the ADA is 30 years old. The Government Accountability Office has been doing surveys of polling places for the last 20 years. And the percentage of polling locations that are still inaccessible has not moved from between 60 to 80%. So, 60 to 80% of polling locations in this country are inaccessible for people with disabilities in one way, shape, or form. Part of that is because we also know that so many polling places in our communities are located in churches. And while churches are exempt under the ADA, because of the Help Americans Vote Act, they are required to make sure that wherever voting is an accessible place. But that might not necessarily mean access to that space. So they could have an accessible space where the polling machines are set up, but there could be stairs leading down there. It could be a very narrow hallway. It could be hard to access in any number of ways. I think one of the things that's been very frustrating to me and to the disability community broadly has been the misuse of the ADA to close polling places, most notably in Native American communities. And last year in Georgia, where we saw the Secretary of State specifically use the ADA to close polling places in low-income communities and communities of color. And thank God for this, but the disability community, Georgia's ADAPT chapter, their independent living centers, among others, teamed up with African-American activists and were like, no, you're not closing polling places in these communities. We can find things that work, but we're not going to have you use one civil rights law to disenfranchise another community that even within that community has disabled people. So you can't be using, it's completely mind-blowing that we live in a day where we're going to use a civil rights statute intended to protect the rights of one community to disenfranchise another.
Right. And it's interesting to hear how those communities came together and people who represented both communities talked about solutions, right? Like, how do we get to solutions? I think that's just a really important issue. And, the work that you're doing is really with your initiative trying to craft solutions. So we have like an audience of thousands of people here at our virtual conference. How can the mental health community do more to advance the equity agenda? How do we get to more of the solutions as we go cross movement, as we think about true justice?
I think for us, it's about thinking about like who's at the table and who isn't at the table. I was talking to my team this morning. We were talking about some work we're going to be doing on making democratic institutions more inclusive. And we went through the list of like, who do we need to partner with on this? Like who in the chronic illness community, who in the mental illness community, within those spaces, who are the leaders of color, who are the LGBT folks, who are the immigrant folks, like how do we get beyond just like the perfunctory checking of the box to say whose voices aren't here, and how do we amplify those voices? How do we promote the right imaging? How do we make sure that as we're putting out language for a conference, and we lay out our values, that we talk about inclusive language, that, in the imaging, that we include people with all different types of disabilities. One of the things that's been a big opportunity for me in the little people community has been pushing for AA and NA at our conferences. Because there is huge issues with substance misuse in the little person community, and it's been taboo for so long. Actually pushing to say, no, we need to have a Friends of Bill W meeting, and having people respond and be like, well, why? Like, that's not a problem. And I'm like, what conference do you go to? It's a very different, we must be at totally different places at the same hotel. But actively acknowledging like who isn't at the table and what do we need to bring them in. I also think creating safe spaces for us to dialogue across different parts of the disability movement. I was so excited when MHA reached out to CAP for us to sit down and talk, because we're really good friends and it's nice to share space with you again. And also because we should be talking. We should be talking way more frequently. We should be talking on an ongoing basis about what are the key pieces of mental health policy that we need to be pushing as a cross-movement group, and how do we help y'all connect with folks in the broader disability space, folks in the civil rights space, and really think through how do we build momentum on a lot of these things. I also think there's a huge opportunity with what Congresswoman Porter likes to call the ADA generation of Congress. The first generation of members of Congress that grew up with people with disabilities in their homes and in their communities, where we weren't pushed off in a lot of cases to institutions and sanitariums and, for my folks, freak shows and things like that, but actively growing up alongside folks with disabilities and seeing people with disabilities as valuable contributors to the work and to society.
Yeah. Can you talk a little bit about some of the issues where you see the most potential for the cross-movement building and the work that we all can do together? Are there some issues that you off the top of your mind, really feel like are some of the major ones we can be thinking about?
I think the fight for the post office is a huge issue, and it's an issue that impacts all parts of our community. Everyone uses the post office, whether it be for basic communication, whether it be for access to prescription drugs that you might have mailed to you. It's really important, I think, for people, especially in more rural communities that may live with disabilities that might not have loved ones near them. I remember talking to somebody and them saying, a person who lives with depression out in Iowa, and she said to me, she's like, Ernie's been my postman for 30 years. Ernie knows when I'm not okay because he notices the mail's piling up. Mm-hmm. And Ernie checks on me. And she said, I might not hear from anybody else for weeks, but Ernie's there like 5 days a week. And she said, and I don't know what, that's a critical part of her personal routine. And she said, I don't know what that means if Ernie's not there to check on me. And it was such an interesting point for me to think about, just in terms of like all the arguments being made around the post office issue. But for a lot of our folks that are in more rural parts of the country, for a lot of our folks that are disconnected from the internet, disconnected from loved ones, and the fact that that person is a routine person in their life is really critical. Obviously the continued fight around healthcare and increasing access to healthcare across the board, increasing high quality healthcare, high quality, inclusive, culturally responsive mental health care for everyone. It shouldn't be a luxury. It should be a standard for everybody, regardless of if you're on, like, if you're a government employee and have great insurance, if you're a public school teacher, like everyone should have access to high quality care across the board. But specifically, I mean, really making that push that Paul Wellstone really started years ago to say that like mental health care shouldn't be like a Rolex. It should be a Timex. Like everybody needs it. Like you should be able to go a few steps out your door and find a provider that gives you what you need.
Mm-hmm. Oh, absolutely. And I think during these times when, as you've talked about, doing cross-movement work, it does create trauma. People need to be able to get assistance when they need it, at all times. And so I think that another issue that, we've talked about that has cross-movement possibilities that I'd be interested in your view is on police and law enforcement involvement with people with disabilities, including mental health conditions. This is another area that we see a lot of conversation, a lot of need. Can you speak a little bit to how you see that and the intersectionalities there?
Definitely. I mean, we know that roughly 50% of the individuals killed by law enforcement are people with disabilities, and specifically people of color with disabilities. One of the challenges is we actually suspect the number is much higher than that. But the way that the data is currently collected by the Department of Justice is, in most cases, it doesn't let us cross-reference or aggregate race and disability. And within disability, aggregate out mental health, aggregate out intellectual developmental disability, aggregate out deafness or other types of disabilities to really drill down and be able to be prescriptive about the kind of remedies that we need. In the conversation around the abolishment of law enforcement, I think one of the things that is very interesting in that conversation is the desire to move funding from policing and from specifically like militarization of the police to social services, increasing access to housing, increasing access to public transit, increasing access to mental health care for a lot of folks. To me, it's one of the most critical issues that impacts all of our movements. When Eric Garner said, "I can't breathe," that was a declaration of disability. He was somebody with asthma. Trayvon Martin, Tamir Rice, so many of the victims of police violence have been disabled people of color, and specifically disabled Black people. And we as a community have to have a real conversation about what that means and what that means for our community and also for the types of issues that we take up.
Mm-hmm. Yeah. And I think that linked with that, we also see that issue for children in the school to prison sort of issues that have come up in the context of COVID. And I know that's another area that you have been very vocal and active in thinking about, because, we need to think about this for our youth coming up and our children.
It really, to me, the fact that, school, it's way easier for schools to get a cop in their school than it is for schools to get a counselor is very problematic. And schools are places that kids should learn, that kids should thrive, that kids should feel safe. And instead, we continue to see just abject levels of policing of our young people, especially young people of color with disabilities. The fact that the Trump administration is still refusing to largely enforce the equity and IDEA rule, which is the rule that came out of the Obama administration that is focused on evaluating the identification, the placement, and the discipline of students of color with disabilities, including mental illness, and looking at how are some districts doing better than others? How are some districts obviously doing worse? And what should we really be looking at? If we see a district where, 50% of the students of color that have been identified as having IEPs are routinely expelled, that's a problem, and that school district is not doing something right. And what are the remedies that we need to be putting into place? I also think specifically for girls of color, it's important to acknowledge that it's not the school to prison pipeline, it's the sexual abuse to prison pipeline. And actually breaking down and having a real conversation about sexual abuse, sexual assault, and trauma, and what it means specifically for girls of color. And I say that as the mother of two African-American disabled sons and an African-American disabled daughter. Like actually breaking that down and having those conversations about those different disparities and how they look differently. And really that conversation around race and disability broadly. We see similar things in the autistic community where folks who, students of color who are autistic are more likely to be identified as emotionally, behaviorally disturbed. Or if they're a girl, they're not likely to be identified at all.
Mm-hmm.
And so how do we actually break down and make sure that the diagnostics that are available are actually accurate for the communities we're reaching out to? And that we frame this conversation not in one of labeling and segregation, not saying, your child is now in special ed, so they're now over there, which I think is a lot of what we do and historically schools have done, but instead say, your child is being diagnosed with a disability. This comes with certain civil rights protections. Let's talk to you about that. What are the civil rights that your child has now that they can be using and what are the accommodations that they can be using to be successful in the long term?
Right. That idea of using this to get people the supports that they need to make sure they can be successful. Looking ahead, those are things that are hopeful, right? The fact that we're having these conversations, that we're thinking through these. What else, gives you hope?
What else gives me hope? Talking to young people. Talking to young people with disabilities around the country about what they're working on, what they're interested in. Talking to people like Alice Wong out in the Bay Area who runs the Disability Visibility Project, who, when I first met her in the Obama administration, it was like that moment in The American President where Annette Bening thinks she's being prank called. Like I called her from the White House because she had submitted an email to the president, or a video to the president for Asian American Heritage Month, talking about the stigma of using home care in a traditional Chinese household. And it was this amazing video. It was so powerful. And I remember calling her and being like, hi, I'm calling from the Obama administration. Do you have any interest in serving the president? And she was like, you're kidding me, right? And like hung up the phone. I called back and I was like, yes, I'm not kidding you. Yes, I'm calling from the White House. Our number shows up 202 and nothing else. So always answer my phone calls. And like, your story is really compelling and fills out a conversation in the disability community that we're not having around race and home and community-based services and stigma. It's talking to people like Alice, talking to activists on the ground, talking to activists like Dior Vargas in the mental health space, who is one of my biggest sheroes and a very dear friend, about the work that she's doing around pushing back on the stigma of mental illness in communities of color. Every time when I saw Congresswoman Ayanna Pressley take off her wig and acknowledge herself as a person living with an autoimmune disability in a video on YouTube. And not seeing shame in it, and instead saying, I'm here to champion my brothers and sisters in this community. And I think that's the thing where, like, as we move from disability being considered so shameful and something that we hide away, to people in very visible roles actively acknowledging it and acknowledging the work that needs to be done, gives me a lot of hope.
Yeah. Well, Rebecca, thank you so much for joining us today. Talking with you always gives me a great deal of hope because of all that you're doing. And it's so important that we continue to work together. And I'm really looking forward to that. We'll take a quick break and be back shortly with Ricky Watson, Executive Director of the National Juvenile Justice Network.